my name is Zein Kattih. I'm one of the advanced lung disease and lung transplantation doctors at Inova Fairfax Hospital in Falls Church, Virginia, and I'm going to be talking about COPD and pulmonary hypertension. So we'll start by talking about our objectives. We'll talk about pulmonary hypertension, COPD or chronic obstructive pulmonary disease, what is COPD-associated pulmonary hypertension, diagnosis, and symptom management. So what is pulmonary hypertension? Well, pulmonary hypertension is high blood pressure in the pulmonary arteries and refers to a serious and complex condition in which the blood vessels in the lungs become stiff and narrow, putting strain on the right side of the heart. PH can affect anybody from newborn to older adults and is caused by a variety of factors, some of which are unknown. What is COPD, or chronic obstructive pulmonary disease? Well, COPD is a progressive lung disease that leads to decrease in airflow in and out of the lungs. It's caused by inflammation of the lungs, destroyed air sacs, otherwise known as alveoli, of the lungs, or problems with the elastic properties of lung air sacs. And it can be caused by exposure to inhalants like cigarette smoke or other chemical fumes. COPD symptoms are wide. They can be and include difficulty breathing, coughing, phlegm or mucus production, and shortness of breath, among many other symptoms. COPD has two common types, and you can see here cartoons depicting the two types. Chronic bronchitis, where there is inflammation in the airways and mucus collecting, and emphysema on the right side, which shows destruction of the alveoli or air sacs of the lungs. What is COPD-associated pulmonary hypertension? Well, COPD-associated pulmonary hypertension is a subtype of PH. PH can be categorized into 5 groups based on the underlying cause. When pulmonary hypertension is related to lung disease, including COPD, it is categorized as Group 3 pulmonary hypertension. The chronic inflammation of COPD leads to inflammation not only in the lung sacs themselves, but also in the vessels of the lungs, leading to elevated pressures in those vessels and ultimately leading to pulmonary hypertension, which can lead to right heart failure and right heart strain. The low oxygen in COPD in some patients can also put strain on the airways and the lungs and lead to inflammation and worsen pulmonary hypertension. How is COPD-associated pulmonary hypertension diagnosed? Your doctor may order a variety of tests, including spirometry and pulmonary function tests, as well as a CT scan of your chest to help diagnose COPD and evaluate the severity of your disease. An echocardiogram or an ultrasound of your heart is the best way to estimate the pulmonary pressures in your pulmonary vessels, so your doctor may also order an echocardiogram. The gold standard to diagnose pulmonary hypertension in any disease, including COPD, is a right heart catheterization. This is a procedure that involves placing a catheter to directly measure the pressures not only in the pulmonary arteries, but also in the right side of the heart. Here, you can see an example cartoon demonstrating that yellow catheter shown in front of you going through the right atrium, a chamber in the heart, the right ventricle, another chamber in the heart, all the way to the pulmonary arteries. How do we manage COPD-associated pulmonary hypertension symptoms? Well, management of PH related to COPD is largely focused on good management of COPD itself. We ensure there's control of COPD symptoms by treating COPD with inhaled medications and most recently even with some biologic agents. We prevent exacerbations and hospitalizations using these medications. We reduce inflammation in the airways as well, again using medications, including inhaled and sometimes oral medications. We prevent infections such as influenza and other viral infections with particular focus on disease prevention, including with vaccinations. We increase strengthening conditioning with pulmonary rehabilitation, which has been shown to help patients with COPD. And in patients who require supplemental oxygen, we provide supplemental oxygen. Thank you. For more information, visit phassociation.org.